My name is Dr. Varick Olson. I've had over 40 years of experience as a university professor, researcher, and clinician. My PhD work was done at the University of Iowa with an emphasis on biomechanics and anatomy and a heavy dose of orthopedics. My clinical area is physical therapy. Within physical therapy, I have started and written curriculum in physical therapy at several schools, as well as have been a clinician for many patients with various diagnoses and injuries. I've also been involved with team sports as an athletic trainer, and during the past few years I've made an emphasis on the endurance athlete, particularly cycling, triathlon, swimming, and so forth. During this period of time, I've developed my own company called Health and Healing Through Movement. And within my Health and Healing Through Movement company, I've developed a program which I call the Symmetrically Integrated Training System, or SITS. Symmetrically Integrated Training System. What is it? First of all, the S stands for symmetry. Symmetry of movement. So how do we determine our symmetry of movement? There are basically several components that are critical for this. First of all, we'll use a SITS bench, which we'll talk about in just a moment, to evaluate your torso muscles and your core muscles in particular. Then the other components of symmetry of evaluation would be, do you sit with a level pelvis? Do you stand with a level pelvis? What is your range of motion of the right shoulder versus the left shoulder? How about the right hip versus the left hip? As you can see, SITS symmetry, the S for symmetry, is actually the symmetry of movement of the spine, the shoulders, and the hips if we're going to perform better. The integrated part of symmetrically integrated training system is composed of the components of life here on earth. Basically activity, which is physical or mental activity, both important in performance in sport, but in performance in life. The next component is nutrition. We all have to have some form of nutrition to be able to perform well. The final component is rest and recovery, and we have two types. We have the active rest and recovery, which is a slow warm down, as we oftentimes explain it to ourselves and to others when we're in sport. And then the other type of rest and recovery is the passive, or how many hours of sleep do you get each night. These three components, activity, nutrition, and rest and recovery, are really the three fundamental components that we have here on earth as well as in sport. If we don't integrate them properly, we can't perform well. The T, or training component, is the actual design of a program that is going to be specific to my individual needs or your individual needs for a program that's going to enhance the sport of our choice or our concern. And then we always want to have some way of measuring results, and so we're going to establish some kind of measurement, either a time of doing the activity, a heart rate, power, or some kind of measurement. So this then is what we call symmetrically integrated training system. Symmetry of motion is critical to performing well. We need to make sure that we understand exactly how we can produce good symmetrical motion. And that is if we have the core muscles functioning in a proper way. So what are the core muscles, and what is the core? The core is defined many times by your magazines and running magazines and all kinds of issues of cycling magazines and so on. But what is the true core that's going to help you perform symmetrically? The true core muscles are the small rotator muscles of the spine, as shown in this picture. These small rotator muscles are connected from a transverse or outside process of the spine to the actual vertebral body. Another small rotator will go from that same transverse process or outside bone component of the vertebrae to the next vertebrae above. And it does it on both the right and the left side. And so these muscles, in coordination with those above and below it, are going to move the vertebrae in a proper way as you do your movement performing with rotation of the spine. These small rotator muscles are all the way from the lumbar area into the thoracic area, all the way up to the cervical spine or your neck area. It's these critical rotator muscles that make up the core of the torso. Another major muscle that you're going to oftentimes hear referred to is the quadratus lumborum muscle, which is shown here. Quadratus meaning rectangular shaped or quad shaped, and then it connects to your last rib, it goes to your pelvis, and it also goes to your lumbar spine. So you can see that when this muscle functions properly, it's going to help stabilize your lumbar spine. The second component of the core is the rotator muscles of the shoulder, shown here in this picture. You can see that these muscles too are relatively small muscles in comparison to the large ones that move the joint, and these muscles really have the function of steering the joint through motion. If they don't fire on and off in a coordinated way, you're not going to be able to have good shoulder function. This last component of the core is the hip rotators. These rotator muscles too are relatively small muscles in comparison to the large muscles of the hip, such as the gluteus maximus, and these muscles literally help steer the hip joint. Again, if these muscles are not firing on and off at the proper time during movement, you're not going to have a stable hip. So the components of the core would be the small rotator muscles of the spine, the rotator muscles of the shoulder, the rotator muscles of the hip. And take note that I said that what you're going to do is have proper coordination of these muscles. This means they turn on and off at the proper time, and then you'll build endurance by doing repeat movements with proper timing. Then you will build strength. So as you begin any training program, it's not about strengthening the core. It's about teaching the core to coordinate in a timely manner for proper symmetrical movement. Okay, Katie, why don't you come on in and I'll show you how to test your torso muscles for symmetry. First thing you'll do is lie down on the bench on your side, and the bench should be adjusted at 20 degrees. This provides a very small excursion of range, which makes the spinal load quite low. Then we would want to make sure that the bench is adjusted for her lower limb length, and we would have her hip bone or pelvis at the pivot point of the flexible leaf, and it is adjusted properly for her. She would then cross her arms on her chest, and then she would keep herself perpendicular to the bench, using the slot in the bench if necessary for her shoulder so she knows she's not rolling forward or backward. And then she would just rise up like so, in this position, as if there was a straight line going through her abdomen down between her legs, and she would hold this position, timing herself for as long as she can hold. She can lie down at any time that she finds that it's too difficult to continue. Okay, after testing her right side, Katie would get up from the bench and walk around just a bit and make sure that she remains flexible for approximately 60, maybe 90 seconds. Then she would come back and test out her left side by lying in the reverse position. And she would then do the same test. She would lift herself up, and then she would hold and time herself for as long as she possibly can. Again, 3 minutes is considered an optimum time, but she will lie down when she needs to. Muscle fatigue, pain, whatever the reason is, she's going to lie down. Now that Katie's completed the test, she has 2 measures, time for the right side and a time for the left side. What she's looking for is to see if these times are approximately the same. If they are, then she has good symmetry of movement. If the time is short, this just goes to show that she needs to improve the ability of these muscles to perform, not only in coordination but also in endurance. Andrew, why don't you come on in, and I'm going to show you how to do a symmetry test for your shoulder and for your hip rotators. It's a relatively simple test, so if you would just lie down on the bench, and we would adjust the bench, again with the leaf positioned at your 20 degrees, again keeping the load to the spine and to the body relatively low, but yet on a very fixed platform. And then we would make sure that your hip bone or your pelvis is at the pivot point of the leaf, like so. And it is. An easy thing to do also for testing of yourself is just to remember the proper length by counting the number of holes where the telescoping tube is positioned for you. The test for the shoulders is going to be a repetitive motion test. The repetitive motion test is a perceived exertion type test. And so Andrew will raise the arm to approximately 40 degrees. This position really triggers the rotator cuff muscles. Don't go much beyond, if any at all, beyond 40 degrees. 40 degrees is a position. And he will do 20 reps in a rapid succession as fast as he can go. And he makes sure that he stays perpendicular to the bench. Okay, very good. Then he would turn over and do the opposite side. Again, a perceived exertion with repetitive motion during 20 repetitions. And what he's trying to determine is whether or not he has the ability to move the arm equally well right and left side. If after say 15 repetitions, he has a tendency to move the arm forward or backward just a little bit, or he rolls one way or the other, this is an indication to him that he is getting fatigued and he does not have symmetry of movement. Then the next test he would want to do is to test for his hip muscles. And as long as he's in this position right here, we will test the left hip muscles, or hip rotators is really what we're testing here. And so now he's going to move his lower limb upward from the platform, the foot platform, about this height and back down. Doesn't need to go much higher than that, because remember that in walking, the total excursion of adduction and abduction, moving in and out of the lower limb, is only about 20 degrees. So you don't need to really exercise through that full range. This is where the muscles really need to be coordinated. So up and down, 20 reps again, and here again he's going to note whether he can maintain his body perpendicular to the bench. If he rolls backward, or he rolls forward, or he starts to turn the toe upward like this, then he knows that he is in fact fatigued and he's got to stop, and he'll record the number of times that he did it, whether it be 15 or whether it be 10 or whatever. Then he will turn over and position himself the same again, and this time he will be testing the right side hip rotators, looking forward, looking so that he doesn't move forward or roll backwards, but can move up and down in this fashion symmetrically. These two tests will give him an indication of his ability to have coordinated, good endurance, symmetry of movement of the shoulder rotators and the hip rotators. Thank you, Andrew. That was very nice. Well, Katie, come on in and I'll show you two tests that you can do to see about symmetry of flexibility. So if you lie on your side, and the bench will be adjusted the same as when you did your isometric torso muscle test, whereby the pivot point is at your hip bone and the bench is set at 20 degrees, and it is. And so now to test for symmetry of flexibility, we'll have you move your arm up over your head and reach as if you're trying to reach for the opposite side of the room, and put a nice long stretch on your body all the way from ankle through the hip and through the torso. And then you would turn over, please. And do the same thing, but with the opposite side. And reach as far as you can. Very good. And what I noticed here is she wasn't able to straighten this elbow quite as easily until I pulled on her just a bit. And then she would also be looking to make sure she was able to stay perpendicular to the bench. It's very critical that you have good flexibility in the sideline position like this, because decreasing flexibility with these muscles from shoulder all the way through the torso into the hip is a common feature of most all of our sport activities as well as our daily life activities. So you need to have a test that reverses what I call the position of immobility of running, sitting, and walking. All of those types of things we do have a position that's fixed, and then we do the movement. We need to reverse that position of immobility. This is a test to do that. Are you equal or equivalent or symmetrical is another word from both sides. Another test that she will do for symmetry of movement will be to lie on her back, and one of the muscle groups or joint positions that oftentimes becomes quite tight with the postures that we assume in daily life as well as in sport would be the hip flexor group. And so she can test this by bending one knee and reaching down and pulling it towards her chest, and the other opposite limb will remain straight and not lift off. If she has tightness, say in this case the left side is what she's testing, she will notice that it's going to follow and pull up a little bit like this. I'm exaggerating here for her, but the sense that you'll get when you do this test will be, can I keep my, in this case, left buttocks on the pelvic pad of the bench? Then she would reverse this position and do the opposite side and pull up as far as she can with the knee and keep the knee straight, in this case the right, and keep the buttocks on the pelvic pad of the bench. Looking for symmetry of flexibility. These are two critical tests that can be done with the sits bench. The sits bench, again, providing a stable platform to do the tests. Thank you, Katie. The sits bench also could be used for back extension exercises, which is an exercise often advocated in sports clubs as well as other kinds of equipment. If you did a back extension exercise on the sits bench, it would look like this. However, I do not recommend any kind of back extension exercise. The reason for that is because the loads placed on the lumbar spine, the lumbar discs, and the small joints of the lumbar spine, when you just lift your chest off of this flexible leaf, are in the neighborhood of 1,000 to 1,200 pounds force, far greater than is necessary for any kind of exercise or any kind of activity. So therefore, it is not recommended to do back extension exercises in any kind